All right, welcome back everyone to another virtual shadowing session at Hearts for Health. Today we're honored to be joined by Dr. Linton, who is an associate professor and the associate dean for admissions at the University of South Carolina School of Medicine, Greenville. We're excited to have Dr. Linton talk about admissions with us today. It's a topic that we haven't seen with many of our other speakers, but we're very excited for today to hear from, and she's going to share a lot of insight. Also, if you have any questions, feel free to type them in the chat. For those who are new, we usually have speakers really from all kinds of fields, all kinds of specialties, and they'll talk not only about their specialties, but we also have speakers talking about admissions in some cases. So today, I'm sure there's a lot of questions, and if you have any questions, like I said, feel free to type them in the chat. Once we wrap up with the presentation, we'll cover those questions during the Q&A. This is going to be a 1-hour session, so in order to receive credit for your attendance today through shadowing, we have a certificate system. So we're going to post via our chat box and on our website a 10-question quiz. You have to get 6 or more, 60% or higher, to pass that quiz. And once you do, you'll be sent a certificate to the email address that you list with your shadowing certificate, letting you know that you've been acknowledged for your attendance today. For those who want to hear more from us with future shadowing sessions, we operate on a Monday and Thursday schedule. Times will vary, which is why it's good to keep in touch with us. And you can do that through 2 ways: our email listserv, which is a weekly email, or our Instagram page, which is another way we go about things, also posted roughly weekly. We're going to post flyers there. We have other programs in addition to virtual shadowing that have just been launched this fall. We're very excited for them. So if you want to stay tuned to that, feel free to either subscribe on our listserv or follow us on Instagram. To subscribe to our listserv, either go to the very bottom of a page, subscribe there, enter your information, or just email us with your information, your name and email address. We can get you added on. Our email is shadowing.h4h@gmail.com. And feel free to reach out with any questions you have about anything to do with Hearts for Health there. With those reminders wrapped up, Dr. Linton, feel free to take it away.
Awesome. Thank you so much, Michael. And it's great to be here with all of you. I only wish I could see your faces because I have no idea who I'm talking to right now, but we're going to roll with that. I'll just talk directly to Michael because he's the face I can see. So I am a pediatrician by training, and I will share quite a bit about admissions, and we'll frame that a little bit in kind of what our school looks like, where I am at the U of SC School of Medicine, Greenville, which is a medical school in the upstate of South Carolina. We're a newer medical school. We started in 2012, so it's now our 10-year anniversary. So what I'll share is specific to our admissions process, but many of the principles are all from what the content that we developed using the AAMC and going and interfacing with medical schools across the country. So a lot of what I'm sharing with you will relate to many other medical schools as well. And then I also was just going to share a little bit about myself, because sometimes my journey here is surprising to people. So I am a pediatrician. I began my career and continue in my clinical work and in my advocacy and academic work to be focused on the intersection of immigration policy and child health. So I currently co-chair the Council on Immigrant Child and Family Health for the American Academy of Pediatrics, which has led me to do some pretty interesting things, like talk to a whole bunch of reporters from all different places, as well as testifying for Congress a few times. And so that part of my job really informed my work here, because so much of what I did and what I do is caring for very, very diverse communities. And my passion in workforce development, meaning developing a workforce prepared to care for our increasingly diverse communities, made it a pretty natural transition into this admissions space. But if people have questions about my clinical work or my advocacy work, I'm also happy to answer that as well. But let's focus on admissions for today. So a little bit about our school. So our vision of our medical school is really about cultivating a culture of curiosity and commitment to others, to transforming the health and wellness of communities. And what I've found is that your generation actually that's an expectation or almost a prerequisite for medical school. I found that our incoming students, this resonates with, because so much of the reason that many students in this generation are planning to go to medical school is in fact to transform health and wellness of communities. And we focus at our school on, like many medical schools, teaching, research, and clinical care. And a lot of that is truly grounded in community, which we'll talk about. So we use a holistic review. And you will hear this from lots of medical schools. I hope that all of the medical schools interpret that holistic in the same way that we do, which is truly to value all elements of your application in a way that tries to bring together a class of physicians or future physicians who represent such a rich diversity of expertise and lived experience. And that means that, yes, we of course look at your MCAT and your GPA, and we also look at all the other elements of your application. So at our school, our class of 2025 was 26% underrepresented in medicine. And actually our new class is 27% underrepresented in medicine, which we define as Black, African American, Hispanic, Latinx, or Native. Our average, we tend to be about 2/3 in state, 1/3 out of state. A diversity of undergraduate institutions, obviously a heavy influence of South Carolina schools because we are one of the state schools in South Carolina. Our average BCPM GPA sits between a 3.6 and a 3.7, and that BCPM GPA is biology, chemistry, physics, and math. So when you go to apply to medical school, you'll enter in all these grades, and then AMCAS will whip out a magical GPA, and it'll give you 2. It'll give you your cumulative, and then it'll also give you your biology, chemistry, physics, and math GPA, which is the one that we use. And then our average MCAT this year, because we're a newer school, we've continued to kind of go up a little bit every year, and now we're at 509 is our average, which is in the 75th percentile, just to give you a sense. With both of those, we have a range. So we have a handful of students every year with MCAT significantly below that average, or GPA significantly below that average. And those students have typically done something to demonstrate that they're academically ready for medical school. Those also tend to be the students that have overcome some adversity, excuse me. So they have experienced challenges or barriers that led them to not have their performance demonstrate their true potential, and have now shown to us that they are in fact ready for medical school. And so we're able to use that holistically to tell us. And then this is just one of the pictures of our white coat ceremony. This is me with a long one, because thank goodness I don't have to go to medical school again, and then a bunch of my students around me. So our applications, like many schools across the country, have tended up over the past several years. Now, obviously, we were a new school, so this was our charter class, and we still got almost 1,500 applicants. But last year, we got almost 5,000. So the numbers are going up. So it is a competitive process. So we're going to talk with you guys today about some of the things that you could do to make sure that you put your best foot forward when you apply. And this just gives the South Carolina piece for us, because we are a South Carolina school, showing that we have the heaviest from Clemson and the University of South Carolina, which are our 2 largest state universities. And this will be true of probably any state school that you look at across the country, is that they'll have a heavy band of state representation. And then we look at a host of diversity dimensions when we actually evaluate our candidates. And I'm going to talk about that a little bit further on rather than showing you. But I think what I want to point out here is that since I started back in 2019, we've really dramatically improved the diversity of our class. And our goal is to have our class, as much as possible in many domains as possible, represent our population. And these are what our diversity dimensions are. And you can see there's a lot of them. So every school that you apply to will have different elements of diversity that they track over time. And it's, again, in an effort to really make sure that we're representing the community that we serve. And there's a few reasons for that. First is that there's really good data that if you come from a various community, whether that's you represent the LGBTQ plus community, or you identify as underrepresented in medicine, or you're first gen, that you are actually more likely to serve that community ultimately. And with physician shortages across the country, that's important information. The second is there's great data out there to show that if you train in a diverse community, you are better prepared to take care of all people. And so regardless of your own worn identity, if you train with people who bring that diversity of lived experience to your school, you will actually learn from your classmates. And I would actually argue that probably 75% of what you learn in the first 2 years of medical school is from your classmates, because you study together and you actually take the information that you learn from your amazing professors and then you work that through so that you can teach each other. So you want to be able to have people that come together that think about things differently and look at things differently. And so we look at, again, underrepresented medicine, we look at rural and we define it as very rural. It's coming from a community of fewer than 25,000 people and is at least 30 miles from a population of over 100,000. So rural. And that's because our state looks like that. First generation college student, we have a pretty open definition of that because we realize that students who don't have the privilege of having a parent who went to college don't get the same guidance as early as preschool in terms of how to prepare academically for a career in medicine. So it's important information that we use to show that, again, those students may need some additional resources, but they also tend to be very innovative, very resourceful, very resilient because they've already overcome so many barriers just to getting to the point of applying. Those students who are socioeconomically disadvantaged, and this year actually more than 1 in 5 of our students come from a socioeconomic disadvantaged background. This is important because actually there's a great evidence out there that historically medicine has really advantaged those who came from privileged backgrounds and probably continues to do so, because think about it. To go to med school, you got to give up 4 years of income earning to go to school, plus all the money you got to pay while you're doing it. So this is a great time for me to say, if you think there's a chance that you might be socioeconomically disadvantaged, please check out whether you qualify for the AMCAS Fee Assistance Program. This is an incredible program that based on your income you may qualify for, and this allows you to actually get some free MCAT prep materials, reduced MCAT exam costs, and reduced fees for all of your applications, including secondary application waivers for some places. So this is a really important program. So if you think there's a chance that based on your family income, you may qualify for this, you should check it out because it's a resource worth using. Those families that come from communities where English is a second language, and then we have a number of second career students every year. In last year's class, we had a former professional actor. This year, we have a pharmacist, a nurse, I'm trying to think. We have an author. So it's always interesting to see. We have a former bomb squad veteran. So it's always interesting to bring in people who come from a variety of backgrounds into medicine, because again, they have such interesting experiences that best help them not only to take care of patients, but teach each other. So at the U of SC School of Medicine Greenville, these are the things that go into your admissions committee score. So what happens when you submit an application? So first, you write your application, and we'll talk about little pieces of that. You write your application and you submit all this stuff to AMCAS. Lesson 1, if you are applying to medical school, so if you're on this call and you're applying this cycle, please, if you have not already submitted, go ahead and submit. Even if you haven't taken your MCAT yet, it takes 4 to 6 weeks for AMCAS to verify your application. So which means by the time your MCAT score comes back, you want your application to be verified so that your score gets released to the schools and you're in process. Particularly for schools like mine, which are rolling admission, meaning we're filling spots on a rolling basis. So as towards the end of the cycle, we're running out of spots. So you got a better shot early. So, and many medical schools are rolling admission. So it's a really important thing to think about. If you haven't submitted, do it. And similarly for secondary applications, get them in. That doesn't mean get them in before you proofread them, but get them in. So once you submit all that stuff, you then go through a review process. And so our committee, and once you're reviewed, if you meet a variety of criteria based on the review that we use, then you might get invited for an interview. And when you come for your interview, you will interview with a whole bunch of people, and we'll talk about what that looks like. And then you'll get a score. So what goes into that score? How ultimately do you get evaluated by a medical school? And most medical schools will look at some combination of these criteria. So for us, we'll look at your GPA. The score is your undergrad only, and we don't care what you majored in for this score. We care because it's interesting. We don't want to have a whole bunch of biology majors from the exact same medical or the same undergrad, right? Like we don't want our whole class to look the same, but we don't give you a different score based on where you went to college, or what you majored in. You get the same score based on what your BCPM GPA was. We look at your MCAT and we use your highest total MCAT score over the past 3 years. So we don't average them. So if you had to take it a few times, we don't take them all and scope them together. We take the highest one. And we also look at all of them in context so that if you've showed demonstrated improvement, that's helpful. Or if you have, took it sick or something happened and you can tell us about why that happened, we have some information. We'll look at your letters, and this is a mistake I see some applicants make, that sometimes students will try and get letters from VIPs, very important people, who don't know them very well. And I would not recommend that because it's really, really obvious when we read those letters. Like, father's a physician and you had father's partner write a letter for you to say something nice, or mother has a really high important job in a university and you have the, boss of that, of the boss of the boss of the boss write the letter, or you have the president of the United States write a letter and they've never met you, right? I don't want those letters. I want to know about you. I want to know why I want you at my school, why you're going to be an amazing doctor, and what you're going to bring to the table, right? That's what I want to know. And I want to know how they know you. And I want to know that they actually know you, not that they just read your CV and wrote you a letter. That is useless to me. I want to know about you. I want to know things that I'm not going to be able to get in the brief time that we interact about you. So think about that as you're doing it. We do not require a physician letter at our school. Some schools do, but we don't. We just want a diversity of letters. We recommend that at least somebody that can talk about your academics evaluates you. That would be concerning to me if you had no faculty letters, because it would mean that you were the kid that sat in the back of the class and didn't talk to anyone ever. And that's probably not a good medical student make if you never spoke with any professor during your entire time in undergraduate. So you should talk to somebody if you haven't already. Extracurricular activities. So what have you done? I don't care how many activities you have on there. I'm not counting them and giving a prize to the person who's listed more. What I want to know is that you did something you liked and cared about. And I'm looking for some evidence that you have sustained involvement and it matters to you. But there's no particular one activity that's the ticket to medical school. It's really about what you did and what you're excited about. Commitment and insight into medicine, we look really at what did you do to learn about medicine and make sure that you actually want to be a doctor and not a pharmacist or a PA or a NP or whatever else you might want to do. We want to know you actually want to be a doctor. And we want to know that you have some clinical exposure that you really love patients. It doesn't have to be only shadowing, right? Like, yes, doing some shadowing is important and you're doing it right now. But it might be that you had to work and you were a CNA and you didn't have the luxury of shadowing 500 hours because you actually had to earn money, right? That's great. Do it and tell us about it. Or you worked at a farm tech at a drugstore to offset loans. That's also great. Like some clinical experience, whatever you can do to expose yourself to the healthcare field that helps us understand what you learned from it and why it helped you know you want to be a doctor. Your interview matters, and we'll talk a little bit about what that looks like. Schools do a variety of approaches to interviewing. Some schools do traditional interviews where you interview with 1 or 2 people in a very traditional way. Some schools do panel interviews where you interview with a bunch of people. Some schools do mini multiple interviews. At our school, we do 2 types because we want to have as many points of contact as possible so that if you don't get along with somebody well, you've got a chance to meet other people so that if you have one bad interaction, it's not the end of the world, right? And because that's real life. You're not going to love every person you meet and everything. And so we try and increase the number of contacts, but we also have a long interview, 1 50-minute, 2-person interview so that you have a chance to get to know some people really well as well. So we do 1 extended panel interview with 2 people where you get some challenging questions. So not just, what's your favorite color and what do you like to do for fun, but some real questions about real scenarios that'll make you think. The most important thing in these kind of things is being authentic and really telling us about you and what you believe. There is no right answer to the question. Again, we're not looking for a cookie out of a cutter. We're looking for whoever you are. And then for the MMI, which is the mini multiple interviews, we actually do something kind of interesting at our school. The same standardized patients who teach you how to do a history and a physical exam are part of our interview process. They actually do standardized patient mini multiple interviews with you, where you actually go into patient scenarios, and they're 5 minutes. They're super fun. They're very low key. We don't expect you to know anything about medicine. You will literally go in there and interact with them and be told, I'm having chest pain and I don't have health insurance. What do I do? And your job is to, number one, care and show empathy, and then talk with the person about how we might handle it. But there's no right answer to it, right? And that's not our real scenario. I'm making that one up. But it's really an opportunity to say, like, what do you do in various scenarios? How do you handle it? How do you think? And how do you help people feel comfortable, even in the virtual environment? For graduate school, certificate, and post-bac. So some students have gone to some additional school after undergrad. Some of that's for enrichment, like they went and got an MPH or an MBA or whatever. And some students, it's because they had some academic difficulty in undergraduate and wanted to do some post-baccalaureate work. Whatever it is, if you do a formal program, we give you credit. And the research component is not required for us, but if you've done research, we'll look at, what you studied, how into it you were, what you accomplished with it, what you learned. And then diversity and distance traveled. So this category is kind of interesting. This looks at the school-defined diversity dimensions that I already talked about. And it also looks at what adversity you might have overcome to get to the point of applying to medical school. And that can look a whole lot of different ways for different people. That could mean experiencing discrimination as a result of being part of the LGBTQ plus community, or your religious affiliation, or coming from a family where English is a second language, or whatever that might look like. It could be difficulties that someone's experienced as a result of chronic illness that they or their family has experienced. It could mean that their family experienced homelessness. We've had multiple medical students over the last few years who at some point in their childhood experienced either actual or at risk for homelessness, or houselessness is the new term. It may be that you experienced challenges from a learning difference and what that was like for you. Whatever that was, we're really trying to get an understanding of resilience and what you've overcome. If you have had an incredibly privileged existence and haven't experienced adversity, that's amazing. Lucky you. Cool. Please don't make it up. Okay? Like, I lost my cell phone while I was on vacation in Belize. Is not adversity. Okay. So if you haven't had real adversity, you can say, like, I'm so grateful for that. And I look forward to the opportunity to whatever, or you don't say something. That's fine. But don't make things up that are not true adversity. And I'm saying that in all seriousness, because sometimes it's interesting and it will not help the application. We don't want only people that have experienced significant hardship like that. We're not looking for one or the other. We just want to understand the context of your application. That's what holistic admissions means, right? We want to understand the context of what you've put on the paper and how that tells us about you. Okay. For those of you who have not yet taken the MCAT, please do not take the MCAT just to see how you do. That is a royal waste of money, and I'll be able to see your score. So I don't know what to do with it. Right? Like, if you haven't studied, the MCAT is not a test you take without any preparation. Now, there's a few keys I've learned over the time here. And some of this is because I have the privilege of being a pediatrician. And so not only am I used to working with students on the med school side, but I'm also used to working with students who experience a variety of challenges when they take tests, which happens. Like, some people get test anxiety. Some people struggle with large quantities of information and memorizing. Some people study with manipulating content. Some people, like me, really, really, really hated physics, right? Like, whatever group you're in, likely the MCAT is not going to be a fun experience. Rarely do I hear a student say, I really enjoyed the MCAT, okay? So if you feel like you enjoyed the MCAT, well done. Can't wait. You'll love your boards. For the rest of us that didn't love the MCAT, there's some techniques. So first is, if you're going to get started and you're one of those people that you're like, I really don't feel like I make the best time studying, and I would argue that's pretty much everyone, that all of us could study a little better, there's a really good book called Make It Stick, The Science of Successful Learning. This book talks about how to study and how to learn. It's super useful for med school. I wish I had it before med school. I read it when I started this role, and I've referred people to it. And I've had students who have had zero resources to do any formal MCAT prep other than buying the Kaplan bundle, which you can get a discount on with the fee assistance program, and pull their scores up by 10 points just by reading the book and restudying and thinking about it differently. So it's something that I would recommend for really anyone before you start medical school, even if you're done with the MCAT, because I think it's really going to help you make the best use of your time. Because med school is fascinating. You learn such amazing stuff, and it's a whole lot of information. And you want to use your time well so that you have time to take care of yourself, right? Like, you can't spend all your time studying. We care deeply about that at our school. We focus very heavily. We have a heavy bend on lifestyle medicine. We're actually one of the, we have a nationally known and now internationally known curriculum in lifestyle medicine integrated throughout our 4 years here at the U of SC School of Medicine Greenville. And we're going to want you to figure out how to study well so that you can play well and rest well, because that's going to help you be not only a good medical student, but a great doctor and a whole human, which is what we want. With burnout being what it is in the world of medicine right now, we want to make sure that you're using your time well. And so Make It Sick kind of helps it. And I have no stock in this book. I don't get any royalties. I probably should, because I recommend it to everyone, but I don't. So I have no conflict of interest in recommending this. The second is utilize resources. So I already mentioned the AMCAS prep bundle. I think it's the AAMC prep bundle, excuse me. And you can go on, and I think it gives you about 5 practice tests and some basic materials. That's a worthwhile investment, because they're actual real tests that are going to give you a sense of how you're doing, and it will give you some time to practice not only the content, but the time management piece. If you are still in college or in a job where you get any free mental health resources, which are most places, and you have test anxiety, use the resources you have while they're free to address the problem. And if you have test anxiety and you don't have those free resources anymore, think about how you might access help anyway, because it will still help you. Because test anxiety is a real thing. And I've seen students who know their content super well, who don't perform as well on a test as they could for a host of reasons. They may have imposter syndrome. They may, based on their worn identity or experience, may have stereotype threat. People like this don't do as well on tests, is what they're telling themselves. Or I was a first-gen college student and I never learned how to take tests, so I'm not going to do well. We got to nip that in the bud, get rid of it, right? Because then I'm not going to see you perform as well. And there's a whole head game to that. So it's the same anxiety that people experience when they go and run a race, or when they go and play in a concert, or when they go and I don't know what other competing things you do. Those are the things that come to mind, because that's what I did. I'm a runner and a clarinetist, right? But like, the same anxiety happens in testing. And for certain things, it can help a little. Like if you're running a 400 meter and you got a little anxiety, it makes you go run a little faster, right? For tests, it does not. It does not help. And so we got to figure out how to manage our brains. And so whatever resources you need to use that, use it. Wait until you're ready to take the test. So if you are not feeling like you are mentally and academically prepared for the MCAT, postpone that test, right? Now, if you've already paid and you can't change it and whatever, then you can, and you feel like you've done at least some, you could go for it. But I do have no problem with people postponing tests. And if you're in communication with a school, just let them know. Like, hey, I need a little extra time. I'm going to take time. Great. You know what? When you get to your STEP exam, we give you a recommended 6-week block to study. And then we have an additional 6 weeks of playtime where if you need more, you can postpone in fact, you can even postpone 8 weeks in our curriculum if you need more time to study for STEP. And in our new curriculum, if you really had to, you can still graduate on time with your class if you had to postpone 12 weeks, right? So everyone needs different time for different things, right? Some of y'all are going to go into your clinical learning environment and you're going to like crush clinics, but tests are going to be harder. Some of you do great on standardized tests. And then when you get into clinics, you're going to have trouble with differential diagnosis. We all have different things. So wait till you're ready to take this exam. Nobody tells you a deadline on this one. Visualizing is a really important skill For some students, that means they actually show up to the test center and practice their drive so that they can actually like know what they're going to do when they get there. For others of us, it's fine just to actually mentally prepare what you're going to do before you stop into that first thing, where you're going to breathe, you're going to visualize like, this is what's going to happen. I'm going to open the computer and I'm going to do that. And when I don't know a question, this is what I'm going to say to myself. And you actually practice. What you're not going to say to yourself is, I'm so stupid, I'm failing this test. What you're going to say is, this is a really hard test. There's a lot of content. I'm gonna move on to the next question because I know a whole lot. And I'm gonna wait till I got a question that I know the answer to. Boom, move on. Right. But you got to practice that. That takes time. And so this is a really important thing about how you're going to talk to yourself in your practice. Preparing your application. Number one, please don't tell me things that aren't true. Don't tell me what you think I want to hear, because I can tell when I read your thing that it sounds like you told me what you think I want to hear. Right. My favorite. Physicians, blah, 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 blah. I know what physicians do. I am one. What I don't know is what Michael does, or what Jose does, or what Joe does, right? Like, I would like to know about you. I don't need to know about what physicians do. Have people look at your application. You want at least a couple of people to look at it for the content, right? You want somebody who knows what applications are supposed to look like, and you want somebody to read it that knows you and says, hey, this sounds like you, or hey, this does not sound like you. And then you need somebody who's really good at proofreading to look at, right? So this is particularly important for applicants who English may be a second language, or first-gen college students who may not have learned to prepare applications in the same way, or may just struggle with where to put a comma because it's not your first language. Like I'm fluent in Spanish, but if I wrote my medical school application in Spanish, I would need to have other people review my application simply for making sure that everything flowed. Even though my speech is, you wouldn't necessarily know. That's going to be really important. Okay. Submitting early, we already talked about. The next point's really important. So you want to include things that you're excited about. You may wish to include elements of adversity you've experienced. If you are not able to talk about those things in an interview, please do not include the details of them in your application. Because if I see it in the application, it means it's fair game to ask about in an interview, right? Now, we really try at our school to inform our interviewers about how to do trauma-informed interviewing and, how not to ask detailed questions beyond something and pay attention to the cues of applicants. However, if, for instance, somebody has experienced a physical or sexual trauma, that is something you have to be really, really thoughtful about whether you wish to include that, or mental health difficulties. You have to choose whether you're ready and comfortable to talk about it. For some students, it's, I overcame a major depressive episode in my sophomore year of college. That's why my grades really kind of stunk in the second semester. I got the treatment I needed and now I'm doing great. And then I've got their junior grades on there and they're all A's, right? Like, please put that in your application. It helps me to understand your application and now you can talk about it. But if you're battling something actively that isn't going so well and you're going to break down and kind of really struggle to communicate during the interview about it, you may want to think about whether you want to put that in your application in detail. And that's not because we don't want people to get treatment and recover, but we don't want to traumatize people, right? Like, I'm a pediatrician, like, I don't want to hurt somebody while I'm interviewing them. I want to get to know them. I want to understand their application, but I also don't want to traumatize somebody. And so I don't want to feel like it's okay to ask you about something because it put it in your application and that it actually is harmful to you. So be thoughtful about it and talk with whoever it is, your friends, your advisors, your counselors, your doctors, about what you choose or don't choose to include. And same thing goes for family experiences, right? Some students choose to include substance disorder in a caregiver or a loved one. And that's really painful for them. And that can be really hard to talk about, or the loss of a parent or a caregiver. So you just have to think about what you include. And sometimes you can word it in a way that's obvious to me that you don't really want to talk about it. That's great, right? Like, I had a really serious trauma my second year of college. It's why my grades went down and I'm doing really well now. I'm probably not going to ask you the details of the trauma, right? Like, I'm just going to assume by the vagueness that you put on there that you don't want to talk about it, and I'm not going to ask you. But there's a risk if you talk about it that an interviewer who is not a pediatrician might ask about it. So just think about what you want to include and what you don't. And I really say this every time I talk to pre-meds, because I've seen actually in the Twitterverse this show up where people are talking about medical school and people just want to hear about all your bad stuff. And I'm like, actually, like, I don't think we do. I want to understand about you. And I want you to think about what you choose to include to make sure that you're safe and you feel supported during the process. And then if you have questions and you're really not sure, we have people reach out to our office and ask our admissions coordinator or ask me, hey, Dr. Linton, I'm really struggling with whether to include something in your application. You could tell me about it. I'm not going to tell anybody in the interview. Everything you share to me as an applicant is 100% confidential. That's part of the expectation. You're under the bounds of FERPA, which is educational confidentiality. And then you can decide whether you want to put in your application. And then that happens with Lucy, our admissions coordinator, all the time, where students will talk to us about what to include. We're happy to help. That's fair. Like ask for help. When you interview, you need to know your own application. So don't put stuff in there, like the details of your research that you don't understand. If you don't understand your research, you should probably not include all the details of it in your application because you might get interviewed by a biochemist who actually does understand it. If you interview with me, I'm not going to ask you those details, right? Because I'm not going to know about how to do CRISPR, right? Like CRISPR didn't even exist when I went to medical school. I know it exists, right? But I'm not going to ask you the details. I might ask you to teach me something, but I don't know the details of it, right? So I think it's just important to put in there what you want. Be professional. We have had applicants put their feet on their desks in interviews. We had, we'll get to some of those stories with the virtual piece, but I'll just say, be professional. If someone introduces themselves to you as doctor, you should use their title, not their first name. That's important. And really try and be attentive to that. Even if you don't remember their name, you can just say like, I'm so sorry, I can't remember your name, doctor. Can you remind me? That's fine too. We don't expect you to be perfect. We do expect you to be professional. If you have technical difficulties for a virtual interview, let the team know. So I live in South Carolina. There are significant portions of the state that do not have reliable internet. So we have applicants periodically lose reception. Now we try as best as we can to have students prepare and get to a place where they have internet, but if it's out of their control, it's out of their control. So just let us know. And then we're happy. We've had interviewers be accepted who had a fire drill in the middle of their dorm during their interview. We had one get accepted who lost internet and had to do the rest of the entire day by phone. That's fine. Like, we're looking for you to be as prepared as you can, but if things happen that are out of your control, we're here to help. Like, we want to just get to know you. We've invited you. We're interested. If you make it to the interview, we're interested in you. Be prepared to address anything that went wrong. So if you bombed your freshman year, right? You came from a really, you weren't as prepared from your high school for college, or you had a personal circumstance or whatever, just be prepared with a plan on how to talk about it. Again, if it's something that you don't want to get into detail, just come with a response that you're comfortable and feel good about sharing, that you probably talk to an advisor about how to talk about it in an interview. Come with questions. We're interested in you. We want to know you're interested in us. And be yourself. Virtual interviews. Oh, these I talked actually about the traditional interviews already, and then our mini multiple interviews. And in our school, 4 of those scenarios are staffed by standardized patients. You get 5 per day, and 1 is staffed by me so that I get to meet everybody. And we're looking really, again, notice no medical knowledge on here. We're looking for your communication skills, your listening skills, your empathy, your professionalism, how you manage conflict. What do you think is right? That's all part of it. There's no medical knowledge involved. Virtual interviews. So, few keys. Number 1, practice what you look like on camera. Like today, this could be neater, right? I could have done a better job making my environment look better, but I came in from a meeting and it is what it is. But you can see at least I'm clean. I'm wearing clothes. True story. We had a candidate a couple of years ago show up with no pants. He did have boxers on, but he stood up at the break and we all saw his boxers. Not professional. Please, whatever part of you might at some point show up on camera should be covered. We did at our orientation this year, though, have one of our students tell us she wore her favorite fuzzy pants for every interview. She didn't stand up during it. We had no idea. And she had a suit on the top and we thought it was adorable. We thought it was that's fun, right? Like if you want to wear something that makes you feel good, that's great. But wear pants or a skirt or something that covers parts that we don't need to see. And then other things, practice what you look like on a camera, right? So this is one of my favorites. We spend the interview like this. I am not an otorhinolaryngologist. I don't want to evaluate your nose. I want to see your face. We also have I like to interview in darkness people. Nope. Please turn on a light. Even if you have terrible lighting in your dorm, you can buy one of these little tiny ring lights for like $6. It is a worthwhile investment. If you're going to spend hundreds and hundreds of dollars on the MCAT, you too can buy a ring light. So think about what you look like and what that says about you and your preparation, right? Again, not expecting perfection. If you have to interview in your dorm room, you interview in your dorm room. If you have to interview in whatever, great. But at least think about what your environment looks like and make sure that you're as best as you can looking at the camera. We actually talked about this already. Couple last things. So all interactions matter. So before the interview, what are your communications like with my team? This cycle, had a candidate storm in after they were declined and tell me the admissions committee had made a mistake and when were they going to reconsider? With not an appropriate volume. And I said, well, I would usually recommend that people get feedback, but this type of interaction is not speaking well to your professionalism, sir. So think about your interactions. On the other hand, we have a bunch of reapplicants that enter our class every single year. They are professional, they're courteous. We get almost 5,000 applications. So if you show us red flags, we're aware. And if you say, hey, I'm really disappointed I didn't get it, we know you're going to be sad. We know you're going to be stressed. What can I do to better my application? And then you ask for feedback, and then you make your application better. And now you've shown growth. And we're like, this is a candidate we really want to meet. Like they got better, they prepped again, they tried again, and wow, let's interview so-and-so this year again. And then you show back up and you're ready for the interview, and lo and behold, you're in the class the next year, right? So how you communicate with us matters. Most of our students do get it on the first try, and that's great, but many don't. That's great too. Again, we're not looking for perfection. We're looking for potential, and we're looking for growth. And I've again reminded you to be yourself. So at this time, I'm happy to answer any questions. If you take nothing else away from this, I hope that you will hear me saying that nobody's journey is linear, that we are not looking for perfection. We do want to get to know you. And we are happy to hear about what your experience has been like. And we're happy to learn from what that's been like and make it better. So with that, there's a picture of, this is my first class. These are what I call my babies. This is the current M3 class. So yeah.
All right. Well, thank you so much, Dr. Linton. I personally found this very reassuring with just the process of considering applications. A lot of students feel like it's more scrutinized than it is.
Yeah, I'm trying to figure out how to stop sharing. I apologize.
Worries. And honestly, I found it very, very reassuring as a student myself. So thank you again. Go through the questions now. And our first question has to do with experiences. So you mentioned a few experiences, like, for example, being a pharmacy tech and others amongst like clinical experiences. Although a student asks, are some experiences, like, for example, being a pharmacy tech, less applicable than others, for example, like being a scribe?
So I do think probably if you're saying, Dr. Linton, what is the most relevant clinical experience that I could get to actually being a doctor? A scribe is pretty high up there, right? Because you're actually with a physician in a clinical setting interacting. The other ones that you might argue are pretty high up there would be doing something like a medical assistant where you actually work closely with a physician. And some of our best students at our school have been nurses or CNAs. or we have a whole, we actually, our curriculum, and I didn't talk about the curriculum at our school, but our first 6 weeks of medical school are actually EMT. All of our medical students here become certified EMTs. And so we have a lot of students who actually come in with some medic experience because they really enjoy that piece of our curriculum. And so that might be something, right? So I would argue that whatever clinical experience is something that you are interested in and helps you, great. And then if you need to earn money, like, and you have a job opportunity in something, like, don't overthink it. Do what you got to do and tell us about that. So say, you know, I really needed a position and I applied for a couple things and this is the one that worked out and I got a lot of clinical experience and I'm really excited because as a pharmacy tech, I learned about medication errors and I, you know, was able to pick up a couple things and I would call the doctor's office to make sure that that was the correct medicine. And we had a great conversation about it. Not, I found those dumb doctor errors and figured them all out. And, you know, but you can spin all these things positively as to what you learned, and you can learn something from any of these experiences.
Absolutely. Our next question is from a freshman right now in college, seems to be a rising freshman in college. They're asking, how should they evaluate the process of taking the MCAT in terms of timeline?
Yeah. So I think it depends on when you want to apply to medical school. For our people that want to go straight through with no gap year, the latest you can take the MCAT in that case is typically the summer before your senior year. And that's often a little late, but not impossible. But I really recommend, if possible, you get through all your prereqs, but particularly biochemistry is very helpful for the MCAT. So if you're able to take that before the MCAT, because otherwise you have to learn that content on your own. And so it's just not, that's not super fun to do. So people want to look at their schedules, and any school is going to have an advisor that does health professions advising. That most schools will have somebody that can help you look through what prereqs might look like in terms of what you take. But I would actually argue that biochem is probably more important than that second semester of physics in terms of prepping for the MCAT.
A question more so to do with your clinical practice. A student asks, what was a compelling factor for you to choose pediatrics outside of other specialties?
So this is a funny story. So I actually thought I was going to be a geriatrician or a geriatric psychiatrist or a palliative care doctor. I love children. I always loved children. I had a narrative in my head that I would not want to take care of sick and dying children and or navigate the complexities of family relationships. I also did an extraordinary amount of time. All of my volunteering through college and my leadership through college was with geriatric patients and or patients with chronic illness. So that was where I was going. I did 1 day of pediatrics and that ended. And I had some people get the aha moment and some people kind of narrow it down on a table. I'm usually the table person. I'm usually the person that really weighs all the decisions. I did 1 day of pediatrics, went home and told my partner that I was done. And he was like, what do you mean you're done? And I said, I'm doing peds. He said, it's your second rotation. I said, I can't imagine liking anything more than this. And I actually loved most of my rotations with the exception of plastic surgery and vascular surgery, which I did not love. But pediatrics just fulfilled all the things I really was looking for academically and also brought me joy. And if you can find a field that brings you joy, that is what you're going to want to look for, because in medicine, there's a lot of days that do not bring joy.
Yeah. There's the good times and the bad times that do happen, it evens out. Another question we have, back to the experiences. So there's some opportunities, like, for example, hospice volunteering that don't necessarily happen in a hospital or clinical setting. How are they considered in terms of clinical experiences? Would they best be paired with another experience that's in a clinic or in a hospital, or is it fine if they're the only clinical experience?
So I think you might get different answers from different people. I think that it's ideal to have more than one clinical experience to show that you've been exposed to different settings. However, I would actually argue that learning how to communicate with patients who are experiencing and navigating death and dying is one of the most difficult skills to learn. And hospice volunteering is such an important skill that you can learn as a pre-med that I think it's a phenomenal clinical experience. I do think having at least a couple different things does show that kind of commitment and insight into what you're getting into. And so I think it's good to try and get a couple different experiences. But I think hospice is a phenomenal experience to get.
And generally, in terms of reflecting on activities, what should students best emphasize with their descriptions? Should it be what they took away, or what exactly?
Yeah, I think so if it's something that's really obvious to me by reading the title, I think you don't have to give me a ton of what it was. But that's often not the case, right? So I'll give you an example. So I went to Duke as an undergrad. I founded a club called Adopt a Grandparent. So I needed to explain what Adopt a Grandparent was. We weren't actually adopting grandparents and bringing them home with us. We were volunteering in a nursing home, right? So I needed a little bit of time, like Adopt a Grandparent is a program that blah, blah, blah. And this is what I did, blah, blah, blah. So I think for many activities, you may need to share a little bit about what it is, but the focus should really be on what you do with it.
And for the students who have either had community college in the past, or let's say it makes up the majority of their prerequisites just because of the timeline of how they went about things, would you say that it's a wise move to take on a post-bac or a master's, even if their GPA was relatively good?
That's a really hard question. It's going to be very individual, and I'll tell you why. So for some, I think it depends in part on their MCAT. The reason I say that is that there's some very good data out there that the AAMC, the American Association of Medical Colleges, publishes every year, that looks at GPA and MCAT on a table and kind of the likelihood and risk of difficulty with moving from M1 year to M2 year on time, difficulty with MCAT. And so if somebody went to community college, but they score, an MCAT that's far and above the average of the schools that they're looking at, that may be less concerning than somebody who has a community college and an MCAT that's in the lower range. And I would say that, again, it's going to be college dependent. So we know our community colleges in our region, we know the type of courses they have. And so similar to us not looking at one college versus another, we try and evaluate that grade as a grade and know that you've done well. And so we look at those things together. Now, if you struggled in community college, getting post-bac work might be helpful, but I would argue that struggling at most places, it would be helpful to demonstrate some solid academic performance. And you can always reach out to an admissions program to get that guidance if you have a school that you're in particular interested in.
Mm-hmm. In terms of prerequisites, again, on timeline, is it better to take them, or is there any advantage generally to take them before applying? Or is it not too much of a problem for them to be taken during that application cycle year? Let's say for a course like biochemistry.
Yeah, totally depends on the applicant. So as long as you've taken them before you matriculate, at least for us, it's a prerequisite before matriculation. And we need to know that you're planning on taking it, but we're going to look at that kind of all in context. I think you need to think about what are the prerequisites you need that will help you prepare for the MCAT. And so for certain students, that's going to be more sciences. For others, they may be able to learn, they may need to take statistics because they're really struggling in that space. And there's some statistics on the MCAT. Or for some students, they need to get better at reading comprehension and take an English class. And so it really just depends kind of on where a student is. It's a personal decision, but we don't prescribe that for people. I would work with your advisor or reach out to the admissions team.
Also, if it's all right to share, are there any memorable examples of personal statements from past cycles that you might be able to share?
Yeah, I think there's a few things. So I think in terms of personal statements, one of the first keys is that they're personal. So you want your personal statement to be about you. So one of the pitfalls is when you tell me all about the field and not about yourself. I think memorable personal statements share something about you that helps me want to meet you. You want someone to read your personal statement and want to meet you. And that usually will require sharing something you've done that is meaningful. That might be a moment from your volunteering that changed the way you thought of things, or that might be some experience you went through as a child that then translated and motivated why you want to do medicine. And then you talk about an activity that you did that helped you develop that skill and then did it. You want your story to make sense and you want it to flow, and you basically just want someone to meet you at the end.
And for yourself, are there any specific examples throughout your training, throughout your career, of working with underserved communities, which is what you emphasized earlier with diversity in medicine, that continues to motivate you through your practice?
Yeah, I've actually never not worked with under-resourced communities. It was why I went into medicine. Even when I wanted to do geriatrics and palliative care, I wanted to either work with immigrant communities or minoritized communities. So I find that being human and being a physician is such a privilege and such a gift that we can give, is to really help families to be able to access the same kind of care no matter what their background is, because every single human deserves to be treated first and foremost with dignity, respect, and compassion. And I find it's really exciting to think about how we can reimagine healthcare in a way that embodies that at a systems level. And so for me in my personal clinic, I care for children in immigrant families with medical complexity. So children with serious genetic syndromes, with really complex neurologic conditions, and I do primary care for them. And really figuring out how to translate their conditions in a way that helps them to feel that they have as much choice as possible in their children's care, or for older kids in their own care, is very motivating. It's very inspiring. And I mean, the best part of what I do is when I go into clinic and a kid that, is newly arrived to the United States, who was not connected to the health system and really didn't have access to care for a particular condition in their country of origin or their community of origin, runs down the hall and kind of leaps into my arms. I mean, there's just not much better than that. So, it's not all easy and it's not all sunshine and roses, but I would also argue that I get that same joy when I talk with a family whose child is, not doing well and has a life-limiting condition. And we talk about what are their goals for their child. And sometimes that goal is just to be able to feed their kid. And so we talk about what do we need to do so that they can take food by mouth rather than having to get it through a tube. And that family gets joy from that. And so I think those are the kinds of things that have always motivated me, and offering the same time and privilege to families, regardless of what their educational, economic, or personal background is really important to me. So.
All right, well, it's the end of the hour, and I think that's a perfect place to land off on for today. So that wraps up today's session. I have a few reminders for our shadowers just before we close. Like I mentioned earlier, you can earn credit for your attendance. To do so, you must pass the quiz to receive a certificate. That quiz is now posted in the chat box and in our under our virtual shadowing page. If you scroll there, you'll see the different quizzes we have. The quiz will be due next week on Sunday, September 4th at 11:59 p.m. Central Standard Time, and it'll be sent to the inbox of the email address you list. Just in case you don't get it, feel free to check your spam folder, or feel free to send us an email and we can retrieve it for you. And later this week, we're going to be seeing Nicole, who is the Assistant Program Director at the PA Residency Program at Johns Hopkins for Emergency Medicine. We have assortment of shadowing sessions, so that's for medicine, dentistry, PA. So really, if you're a pre-health student in general, you can take away something from our program. And we're going to see her at 7 p.m. Central this Thursday, September 1st. For those who want to keep an eye on future shadowing sessions, just follow us on Instagram or subscribe to our listserv. But yeah, that's all. I want to thank you again, Dr. Linton, for joining us. This was a very informative session. I think it was one of our firsts to do with just completely admissions. We've had a few with people in the admissions process and some questions here and there in the Q&A, but I'm glad we can circle around to a session completely dedicated to it. It was really, really insightful for me, and I'm sure a lot of the students listening would say the same. So again, thank you.
Thank you so much for the opportunity. I really enjoyed it.
All right. We're going to close for today. And like I said earlier, you guys can catch